Welcome to Topic A on WYLN. I'm your host, Ann Gownley. According to the Autism Society of America, autism is the fastest growing developmental disability with 1 in every 68 births. This month is Autism Awareness Month, and join Dr. Cassandra on here on Topic A, where we'll discuss different things about autism, the Autism Month itself, and information that you'll need on upcoming events here in our area. Stay with us for more details coming up right here on Topic A, only on WYLN. Welcome back to Topic A. I'm your host, Ann Gownley, and I am once again joined by Dr. Sandra Kirshner, a behavior specialist consultant with Children's Service Center. Tell me a little bit about the center itself, and obviously this month is Autism Awareness Month, and it's not only during this month that we need to be aware of autism, and we were talking before the show how important this is to get out to the public and bring awareness to autism. But first, let's talk about your company and how the services that they provide really and truly helps out families.
Children's Service Center, the office itself, our main office is located in Wilkes-Barre on Franklin Street. We are actually celebrating our 152nd anniversary this year, so we've been around for a long time. We provide a lot of different services, not just autism. We also have satellite offices in Danville and in Tunkhannock, and we're actually talking about opening a satellite office in Hazleton as well. We provide numerous services, not just the wraparound services, which is what I do for autism in the Hazleton area, but we also provide general mental health services for children, medication clinic, outpatient services for therapy where the children go to our office instead of in their communities. We do adoption. We have a group home. We do blended case management. So there's a lot of different services that are provided at the agency.
And you yourself, you work in the schools with children that you deal with autism. That's your specialty when it comes to this. We're talking about Autism Awareness Month. Tell me the background and the things that people really need to understand when it comes to autism. What can you say about that?
Well, first, the most important thing to know just is a little about what autism is in general. So autism is a pervasive developmental disorder that affects an individual's development across their entire lifespan. You don't grow out of autism. You might learn the skills you need to function a little better, but the difficulties that they have exist. So we also need to recognize that these aren't just children. They're going to grow into adults, and we need to provide for them. The main things that you're going to see when you look at the autism spectrum are a lack of language development or an odd use of language. So depending upon where a child falls on the spectrum, because autism is a spectrum disorder, no two children with autism, no two adults with autism are the same. You have the range from very mild autism, what is often called Asperger's disorder, down to a nonverbal, a very low functioning autism that it affects them more globally. So there's some kind of language component. There's often a socialization component. So children on the spectrum might be aloof. They don't like to socialize. Or when it comes to the more high functioning children, they want to socialize. They can't read the social cues. They might not read facial expressions very well. So they have a hard time interacting. When you smile, what does that mean when you smile? Does that mean you're happy? Does that mean you're sad? Do you like what I'm saying? A lot of children on the spectrum, there is a disruption in eye contact, so they may not always look at the person that they're talking to. They use a lot of peripheral vision, so they may be looking at you, but it doesn't look like they're looking at you. There's also often a sensory component, so children may react either very strongly to certain sensory input, so touch or smells or or visual things that they like to look at versus, or they might not react at all. So some children, it can be very scary for parents because some children have no pain awareness at all. They could fall and seriously get hurt and not act as if they're hurt at all. We're
talking a lot about the different symptoms and the different signs, but there are a lot of people out there that are unaware that their child has autism. It takes maybe years, it might take months, and it's not going to happen right at birth. Obviously,
No.
You're going to have to wait for those signs, meaning speech in particular, and the way that they act, and you just said eye contact. What could you say to those parents that are unaware and they're kind of on the edge thinking, do I need to take them to a doctor or to a specialist, or are they okay?
I mean, personally, I think that if, as a parent, you have any doubts about your child's development, if they're not making eye contact, if at age 2 they're not using single words, if at age 3 they're not using short sentences, if you're concerned about the rigidity of their behavior, go to the doctor, get it checked out. If you know, unfortunately, there are a lot of pediatricians that are not as well educated about autism as they might be. And so if you go to your pediatrician and they tell you everything is fine, and that you really, really feel in your gut that something is wrong, reach out to a specialist in autism. There are neurodevelopmental pediatricians in the area who specialize in autism. There are agencies like ours where you can have your child evaluated if you really feel like there might be an issue.
Because something else that we're talking about the behavioral portion of autism and the side of it, but they're also children as well. So there are a lot of different aspects to this to look into, because not only do they have autism, but they're also a child.
Exactly.
So they're also 5. So some of those behaviors are going to see that. So what I want to talk about now is you know, this is Autism Awareness Month. Obviously, we want to get the word out there and let people know what autism is, and God, you know, if we need to find out if our own children have it, the behavior. I mean, we were talking before, they are still children for them when they're younger, they're children, but they do, obviously, into adults, it's going to be with them forever, but they are children as well. So we're talking about just interacting with a child with autism and being able to see it.
Well, like I said, it depends on the level of functioning, whether you're talking about a lower functioning child on the spectrum versus a higher functioning. Obviously, with a lower functioning child, it's going to be a lot easier to spot. There's going to be either a complete lack of language, or there's going to be minimal language. They might not use language to communicate. They may only repeat things that they hear. So that's a little more obvious for people. What gets a little trickier and is hard for a lot of people is when you start talking about the children that are on the higher end of the spectrum, towards the Asperger's end, because it's not immediately obvious. They speak, and some of them speak very well. You know, some of them are incredibly intelligent, and just because they speak with, you know, you might have a 5th grader who reads on a 12th grade level but can't put his own code on.
Right.
So don't look at, you know, it's really important for people to remember that you can't always judge what the child is doing based on their scores on a test or their reading level, or because in autism there are things called splinter skills. Development is very uneven. So they might have very, very high verbal skills, but their coping skills or their attention span might be like a 3-year-old, even though they read on a 12th grade level. And that's really hard for people to wrap their brains around.
Absolutely. When we come back here on Topic A, I want to talk about statistics, and actually a new statistic just came out recently, so we want to talk about that and other services that Children's Service Center provides. So we want to talk about that, especially when we come back here on Topic A. It's Autism Awareness Month, and hopefully we will give you all the details that you need right here on Topic A, only on WYLN.